The following was recorded in front of a live studio audience at the Studio 21 Podcast Café. This is the United Podcast Network.
Welcome to the Friends in Recovery podcast, the podcast that is here to help you, a loved one, or a friend get started down the road to recovery. This is the Friends in Recovery podcast, brought to you by the Genesis House. Genesis House, providing a safe, nurturing environment to heal from addiction since 1992. Please be a friend and share our message with a friend on Podbean, iTunes, iHeartRadio, or YouTube. And now, here are your Friends in Recovery.
Hey, welcome everyone to Friends in Recovery podcast. We're broadcasting live from the Studio 21 Podcast Cafe. I'm Mike Miles.
Rich Lombardi.
We're happy to be here.
Yeah.
Yeah, Jeff and Ed couldn't be here today.
They're somewhere on a road somewhere.
But just real quick, we can be reached at help at friendsinrecoverypodcast.com. We can reach us by telephone 1-800-989-6504 or www.friendsinrecoverypodcast.com. Also look for us on Facebook, Twitter, and Instagram. Be sure to like us and subscribe. We would like to thank Genesis House for sponsoring Friends in Recovery podcast, as they do every week, and we are so fortunate to have them. They're a class organization, and believe me, they care and they provide great services. Now back to Studio 21 Podcast Cafe and our show, and who's on the phone, Rich?
I think we got Ed on the phone. Ed, are you on there?
Can't get rid of that guy.
Hey, guys. How's it going, everybody?
Good.
Jeff's with me, too.
Oh, hi, Jeff.
Where are you guys? Are you guys up in Montreal or something? Where are you?
Well, we're not far from Canada, but Ed and I actually went to Minnesota, and we presented at the Minnesota Women's Police Association annual conference. And they were interested in having us speak on police women who have issues with trauma and alcoholism. So we did a whole pack-a-morning workshop for them, and it was actually a great hit.
It was.
We were very successful, and Ed is actually driving me to the airport to fly back to Boston. I'm taking Jeff Blue back, and then tomorrow I'm presenting at the New England Narcotics Office's annual meeting in Newport on the same subject, as it turns out.
Yeah.
So we do a lot of work with law enforcement, people with substance abuse disorders, and as you know, Mike, it's somewhat prevalent. And as you know, Rich, in corrections and law enforcement, it's a big problem due to all the stress and trauma.
And guys, we really missed the show. We really missed being there. So I spoke to Mike, and Mike said, "Yeah, come on. We'll do a quick phone call, and just so we could say hello." And this it's like being home when all three of us, and you too, Rich, when all four of us talk. So
yeah, well,
we
thank
miss
you.
you guys.
Thank you.
Well,
And we're in the lovely state of Minnesota right now.
Yeah,
so.
it's a great state. A lot of wonderful recovery there. You got lots and lots of wonderful recovery there.
Absolutely.
Yeah.
Yeah.
Hazleton, is that what Hazleton is?
Hazleton's there,
Hazleton,
yep.
And Mary Tyler Moore, I think
I'll give a shout out to the Pacifica meeting on Thursday night downtown.
There you go. I'll be there Thursday night.
Oh, head over to that meeting, Ed. It's a great meeting. It's a Pacific group. It's out of California.
Mm-hmm.
It's a great meeting.
Yeah, absolutely. So, but guys, we just want to thank you. We'll I got to get Jeff to the airport, and we want to just kind of be part of the team, and we'll sign off for now. Thanks, everybody.
All right.
Safe travels.
We'll see you.
Good. Have a great show, guys.
All right.
Thank
Safe
you.
travels.
Awesome.
See you, Jeff. See you, Ed.
Good to hear for those guys.
Yeah, it was good hearing. Yeah, good. Yeah, we have a lot of fun, and they do a lot of good work. I think doing this type of work, Rich, and as you know, it can be tedious, it can be stressful, it can be, it can be dangerous sometimes.
Yes. It's there's blessings and the curses, right? The blessings is that we're able to help people, and unfortunately, sometimes we're not.
Yeah, you get those phone calls where people have succumbed or suicide or, just in a bad way. And all of a sudden, whatever you're doing, you have to stop and you have to get in that mode and off you go. It's very difficult sometimes.
Yeah, and unfortunately or fortunately, I guess we're going to talk about a difficult situation tonight.
We are. What do you got with you?
Well, we're going to talk a little bit about the opioid crisis. I know obviously that's in the news these days, and You know, I was thinking as just before we came on. You know, I've been doing this now since 2005, and you know, it seems as though it's always like up and down, kind of like the disease. You know, it progresses. Sure. Sometimes we're a little proactive, and then unfortunately, sometimes we're maybe a little reactive. Right. You know, because it does come down to sometimes the funds.
Well,
you know?
it's such a coincidence that we are talking about this. I spoke to a state representative from Lowell. His name is Thomas Golden, and he was way ahead of the curve.
Yeah, yeah.
He's been doing this. When I say doing this, trying to help people with addiction, but specifically the opioid, for about 10 years. I mean, honestly, well, you know, Lowell's a city that there's been problems forever. He was responsible for opening a detox that was closed, reopening or having to reopen.
Yeah.
I spoke to him on the phone. He was going to be a guest today, but as a result of all the stuff that was going on, we kind of got our wires crossed. My error. Yeah. But you know, it's really good to have somebody, because I know that they're making improvements. I know the statistics are going down, but the statistics are so high that it's just it's like a little pebble being thrown into a lake. You know, it doesn't mean much.
So this afternoon, I tried to do a little research. You know, I'm not a big numbers guy or whatever, but I tried to do a little research today, and I went into the National Institute on Drug Abuse. So, you know, if you're struggling with addiction, or if you have a family member, a son or a daughter or a husband or a wife or, you know, whatever, and you're not quite sure, you know, what's really going on or how to, like, approach these type of things, there's so much information on the internet now. Absolutely. And basically you just find a little bit about everything, kind of educate yourself, and then, you know, like I do, you know, like I said, I've been doing this for a long time, and I continually educate myself.
You certainly do.
You know, because you can't know it all. I mean, you can't know it all, right?
No, you never can.
And so I was doing my research every day right now. This is as of March 2018. 115 people a day die in the United States of overdosing on opioids. I mean, if you times that times 365 days, I mean, it seems like it's like unstoppable.
And what was the date on that?
This is as of March.
March of this year.
Yeah, from National Institute on the Drug Abuse. Wow. And then I did you know, and so we've seen a lot from the current administration. You know, trying to step up a little bit.
Absolutely.
You know, and I know you know, everybody has their thoughts and opinions and this, that, and the other thing. But we got to put that aside, right?
Put politics aside.
Principles before personalities.
Absolutely.
And you know, those are some of the things that I've learned in recovery.
Absolutely.
You know, to accept other people's opinions and their thought processes. I don't always have to agree.
No.
But anyway, so the Trump administration right now is committed to bringing everything the federal government has to bear on the health emergency. And so they've considered this an emergency, a health emergency, which, you know, 115 people a day.
It's an emergency.
And it's not really it's heroin, but really now it's
prescription drugs.
Fentanyl, and the prescriptions.
Fentanyl's awful.
Oh, it's just terrible. It's just terrible. So we've identified they identified 5 specific strategies, which you know, I mean, improving access to treatment and recovery services. Right, we all know there's not enough beds. Right, there's not, you know, and so everybody's always fighting to get into the place. Absolutely. Promoting the use of overdosing drugs. So I'd like to talk a little bit about this today. This is Narcan. This is a nasal spray. It's a 4-milligram nasal spray. It comes in a twin pack. And if you have a family member, don't be embarrassed. Don't be shy. Because these can save your life. Yeah, these can save your life. It comes with the full directions on the pack. And as you see, it's very simple to use. Basically, you just pop it open, you take the cap off, you put it in the nostril. Give it a shot. And it reverses the effects.
Certainly does.
But unfortunately, sometimes with the fentanyl, you need more than one.
Yeah.
Sometimes 2 or 3. But you get on the phone, you call the ambulance, call the proper people. By the time they get there, you know, basically we're just trying to get them to the next level.
Alive.
Keep them alive and get to the next level. And these are available at any health center throughout Massachusetts, throughout New Hampshire, through most of the states now. You can go to the drugstore. You can tell them you'd like to do it. You do have to show an ID and sign a piece of paper, but there's no they don't tell the authorities or anything like that. And so just another wonderful thing here. So, and these are available, I mean, all over the place now.
I have a twin pack in my car. I've had it.
I carry them everywhere I go now. Absolutely. Even though I'm in recovery, I don't shoot heroin, and I'm not using any drugs today. But I go to a lot of different events. I go to a lot of different functions.
You can make a difference.
Yeah, you just never know.
Right place at the right time.
A lot of, unfortunately, people overdose in McDonald's, in the bathrooms, on the side of the road. Yep. Matter of fact, I saw a video last night. Some guy videotaped a couple of people overdosing online and kind of made fun of it, embarrassing the people. You know what I mean?
Yeah.
And it's just sad. Yeah. And then obviously we want to educate. So strengthening the understanding of the epidemic through the public health surveillance. So now we have all these different health places. They're actually keeping documents now. They're documenting all this stuff.
Statistics.
So they can, get the statistics and, have a real better grasp on, kind of really what's going on out there. Providing support and cutting-edge research in pain and addiction. A lot of people are looking, and we were just talking before the show about holistic type of ways to alleviate pain.
Absolutely.
Acupuncture, these different Reiki, I think that's what it's called. I'm not really sure, but anyway, that's another thing, and herbs. Sure. So there's a lot of other different things. And then, obviously, better practices for pain management. Because, as we know, there's a big controversy out there about the pharmacist and the doctors.
It's very difficult. And they're taking a hit. The medical profession, doctors, not so much the pharmacists, but definitely the doctors.
Yeah.
But, I mean, they're educated to help immediately and to alleviate pain. And I don't think they think beyond the initial, prescription they write.
Yeah, exactly.
But now they do. Now the education. I think out of all these 5 points here, the education is the big thing. And I really think we could have saved a generation if this was looked at 10 years ago. There's always been a very, as you know, I'm a city guy. Yeah. There's always been a very severe opiate addiction. It was mostly heroin. It wasn't fentanyl.
Yeah, Percocets.
But
Vicodin.
A lot as a young cop working the streets back in the 80s. I can't tell you how many people overdosed, and they would be from outer city or different towns. And it never was newsworthy. It never really made the news because it was it was always someone else's kid. But nowadays, as we know, it's cops' kids, it's lawyers' kids, it's doctors' kids, it's anybody. It's your neighbor, it's the teacher's kid. And this is the thing that all of a sudden society got on board. Unfortunately, we're losing people at a high rate, but I think we're starting to reverse the curse. Yeah,
and I think that as we come up with new methods, and hopefully the DEA and the local police. I saw today online also that someone, they just arrested the guy down in Winthrop. $1 million and 4 pounds of cocaine. And it seems as they're banging down doors again and, really, putting a clamp on this, hopefully. Sure. The other thing that I wanted to say was that right now, all 50 states they've come up with $485 million in grants to advance the base prevention and treatment activities. Right. So he's putting the money where his mouth is. Right. I mean, despite whatever you think, absolutely. They're putting the money out. Right. And that's really what we need. We need funds. We need to be able to take care of people, treat people. Not a lot of people, unfortunately, on the street have insurance. Nope. Most of these folks, unfortunately, they're not. They don't have health insurance or any of that type of stuff. Most of these treatment facilities, they do require some insurance. Absolutely. But now with grants and stuff like that, hopefully we can get some scholarships and things of that nature. Sure. Geez, I meant to ask him when I was talking to him, too. I'm sure maybe Genesis House has thought of some of that stuff, Yeah.
Oh, I've used Genesis House probably, I'd say, for the past 6 years. Yeah. Sent a lot of people in law enforcement. Mm-hmm. Close friends, family, people down there. And, they do a great job. And, to work the process, in other words, to start from point A where you make the phone call, you get the person on board to go. Right. To get them there, there's a lot of work involved.
Yes, exactly,
And just to get somebody that's ready to go, eager to go, now that's the big part. Yeah. Now you call and you find out some of these places, they don't want to take you. They don't have the right insurance. Yep. So what do you got? You got somebody who's going to be resistant to going through this process again.
Exactly.
Sometimes you only get one shot at getting something.
Exactly.
Help,
No, I know, yeah. Well, unfortunately, as we know, yeah.
So I can say one thing for Genesis House, and I know firsthand. And they're not a big conglomerate. They don't have 5, 6, 7 places. They have one place. Yeah. And they do a great job. And, we're very fortunate to have them, as a sponsor, but also as somebody, as a refuge and a place that we can use.
Exactly. And by the way, don't forget the phone number there. What was it again?
Yeah, the 1-800 number. Hold on. Is this...
Yeah, 800-989-6504.
Correct.
Listen, if you're having problems, if you're in trouble, if you're afraid, please reach out, call us, email us. What was that? I don't have the email there. What was that again?
Well, we have several emails, actually.
Okay.
We have the friendsinrecoverypodcast.com. We have helpingfriendsinrecoverypodcast.com.
Yeah.
Yep. And
please reach out.
absolutely.
Reach out. And if you have a family member or something or you're not sure, we'd love to answer questions. Right. I know Ed is always up for answering questions. And, if we can help anyone, we certainly would,
And on an individual, level, my cell phone is 978-833-0187. 978-833-0187.
Nice.
And the reason I give that out is because you might need information. You might need someone to talk to that's going to be able to give you some opportunities to network and call some people. And it's good to talk to somebody who knows what they're talking about. We put our money where our mouth is. We're here to help people.
Exactly. The other, we're
going to take a quick break.
Okay.
Yep. And we're going to take
Wow, that was quick.
We'll be back. You're listening to Friends of Recovery Podcast live from the wonderful, beautiful Studio 21 Podcast Café.
Put that hammer down and check out the Don't Do It Yourself podcast. The Don't Do It Yourself podcast is a weekly podcast where Tommy Two Shoes and No Nonsense Nance sit down with a different specialist every week. If you're tired of unvetted and uninsured contractors charging too much money for not enough quality, you need to check out the Don't Do It Yourself podcast, the Contractors Referral Program. The Don't Do It Yourself podcast is live on YouTube every Thursday morning at 11 a.m. or on demand on iTunes, Podbean, iHeartRadio, or your favorite podcast catcher. Put that hammer down and don't do it yourself. Genesis House is a premier substance abuse and rehabilitation facility located in beautiful Palm Beach County, Florida. We have been providing the highest quality of addiction treatment since 1992 and are accredited by the Joint Commission. We offer a range of programs that include detox, residential treatment, dual diagnosis, a Christian track for people who want to incorporate their faith into treatment, a uniform services track, and we work with most major insurance carriers. Genesis House is led by a dedicated team of administrative and clinical professionals, and we stand on our commitment to excellence in recovery services. Contact us today to find out more about our program. Take the first step and call Genesis House at 800-737-0933 or visit us on the web at www.genesishouse.net. That's 800-737-0933 or www.genesishouse.net. Begin your journey to a long and successful recovery with Genesis House.
Richie Lombardi, the Step Guy, joins us once a month on the second Tuesday, where we plan to get in-depth with each of the 12 steps to recovery. Come get sober with the Friends in Recovery podcast and Rich, the Step Guy, Lombardi. Also, don't forget to subscribe to our podcast to get this and every episode each and every week.
Hey, welcome back.
Yep.
Friends of Recovery Podcast, live from the Studio 21 Podcast Cafe. And I'm here with my good friend, Rich. And I think today we have you're going to be taking Ed's spot and doing a little...
I hope I can live up to the hype, you know what I'm saying?
It's going to be difficult. You got
Hope
more
I can
hair
live
than
up.
him.
I hear you. Nice. So, welcome to the Time Takes Time portion of our show. Sponsored by the... Time. Oh, I love singing to this. Time takes time. Wow, I feel like a real movie star. Yeah. Time Takes Time portion of the show, sponsored by Genesis House. This is where we ask our friends in recovery to email us your sober anniversaries so we can celebrate with you. Congratulations. I have some folks here on my cell phone. Hang on a second. I got some people.
Luckily, I have them on my cell phone.
Yeah, some people texted in.
You got them, yeah.
And I'd like to congratulate Jason T. from New Jersey, 2 years of recovery. Congratulations. John K. from Washington, D.C., another 2 years. Wow, miracles. Erica Lafette from New Jersey, 7 years. And Mr. Groton, Lou N. from Groton, Connecticut, 11 months. And Sarah T., Providence, the big one. 1 year.
Pizza.
Congratulations. If you'd like to celebrate your anniversary with us, please email us your first name, last initial, city, state, anniversary date to help@friendsinrecoverypodcast.com. Once again, help@friendsinrecoverypodcast.com. Remember, time takes time. Sponsored by the Genesis House. And listen and your name in our upcoming shows.
Very good, Richie.
Congratulations.
Ed will be very proud.
I hope so. I hope so. I'm doing my best.
Than he did. Time takes time.
Hopefully he's not listening. No, hopefully he is. I'm sure he is. So when we were away, I wanted to talk a little bit about what they're doing, the Health and Human Services. What are they doing about this crisis?
Right.
And so one of the things they're doing is they're improving access to the treatment and to the recovery services, promoting use of overdose reversing drugs, strengthening and understanding the epidemic through public health. And then also here it says, what do we know about the opioid crisis? Roughly 21 to 29% of the patients prescribed opiates for chronic pain misuse them. Another thing is between 8 and 12% develop an opioid disorder. So 21 out of 29% abuse them. Next thing you know, they got an opioid disorder. 4 to 6% who misuse prescription opioids transition to heroin.
Right.
And so you can see the transition, right? They start. I talk to a lot of, I work at the county sheriff's department, and as you know, I do counseling and stuff, and I talk to a lot of the clients, and a lot of them have started with sport injuries.
Sure.
Football,
Most
knees
them,
in
yep.
high school, or car accidents. Yep. They're prescribed these Vicodin and these other painkillers, and after a period of time, now they're out.
Right.
The doctor doesn't want to give them anymore. Maybe they still have pain, maybe they don't. Now all of a sudden, as you see, they begin to misuse them, and now they're on the street.
Right.
Now they're going to look. And it's hard to buy these pills on the street. It's a lot easier to buy 10 bags of heroin, unfortunately,
Yep.
than it is to buy 10 pills.
Absolutely.
And it's cheaper, sadly enough.
It's more dangerous, too.
Yeah,
Because, a lot of heroin laced with fentanyl.
Yep.
Fentanyl is a very cheap. It's a very cheap to buy
and cheap to make.
Cheap to make, and it's very dangerous. I mean, there's no getting around it.
And people think they're doing one drug, and they're really not doing that
Correct.
drug. And unfortunately, then they suffer the consequences, as we know. About 80% of people who use heroin for the first time misuse prescription opioids. Opioid overdoses increased 30% from July of 2016 to 2017 in 52 areas in 45 states.
30%. Just think of that.
It's huge.
Imagine if you had investments for 30%.
Yeah, exactly.
1 year.
Yeah,
It's
you'd
unheard
be a
of.
very wealthy man.
Yeah, 30%. It's crazy.
And then in the Midwest region, saw overdoses increase by 70% from July 2016 to the 17th. And I was looking at a chart here just a few minutes ago in Massachusetts, right here from 2012 to 2016. It increased from 10.4% to 29.7% of overdoses in the state. It just, it spiked. Up until that point, it was pretty level, and this is when the fentanyl came in. Right. So when the fentanyl came in, it just went through the roof, unfortunately. So I said 2016, there were 1,821 opioid-related overdoses in Massachusetts, a rate of 29.7% per 100,000 people. Right. I'm not a big numbers guy and all that, but it's nice to know, like I said, educate ourselves and see what the true numbers are. Compared to the national rate of 13.3 deaths per 100,000 persons, since 2012, deaths attributed to heroin overdose have increased 246 deaths to 630.
Right. That's great.
So you see the big spike there.
Right.
And listen, we're not trying to put the light on any particular state or anything like that. It just happens that I picked out that because I'm familiar with Massachusetts. A little bit about New Hampshire. Unfortunately, I just heard a report in New Hampshire that the HIV now, because of the intravenous use, is skyrocketing through the roof.
Something
People are
that
sharing needles.
Absolutely.
And there's a lot of talk now about needle exchange.
Sure.
It has its controversies, its ups and downs. Sure. It has some of that stuff. You got some old school folks that maybe aren't on board. But then listen, we're trying to get them to transition. Yeah. Right.
Well, that's the good news. There is help.
Yeah.
And you don't have to live that that life of teetering on death every day. You decide to get help, and people like us will help you.
Yeah, exactly.
People like
exactly.
Genesis help.
Yeah, and you go either Genesis House or, obviously, we have
anywhere.
Meetings.
Any facility. Right.
Yeah,
right.
meetings, detoxes. I mean, there is help available out there if we seek it.
What do you think the biggest fear is, Rich? Let me just ask you a question. What do you think the biggest fear is for somebody that's addicted to opioids to stop? What is their biggest fear?
Getting sick.
Correct.
Right, they get sick because this particular drug attacks your central nervous system, and the only way you feel good is when you're using.
Right, and I've spoken to a doctor a few months back, several months ago, and we talked about recovery, and he was telling me, which was a very interesting fact, that alcoholics, severe alcoholics, chronic alcoholics, they can actually die by stopping drinking.
Exactly.
Most people that are using opioids, they're not going to die. They're going to be sick.
Yeah.
They're going to be in pain, but their organs aren't going to shut down.
Right.
They're going to be miserable. They're going to be sick.
They're going to have the hots, the cold sweats, the other things.
And I think, knowing that it's going to be a period of time, 3 days, 7 days, 11 days, who knows? It's going to be around 2 weeks.
Yes.
And every day it'll be a little bit better,
Exactly.
But you're not going to die.
Yeah.
Now, you take someone who's a chronic alcoholic and you put them in a hospital setting and don't give them anything, they could die right away.
Yeah, causes seizures.
Correct.
And other things. Your organs can shut down, and so they need to kind of be transitioned through that.
Right. So my point is basically, if you listen to the show, or if you know somebody, there's going to be some turbulence and there's going to be some sick and suffering moments, but coming out the other end, that's what's important. You get your life back. You get back on track. Just to have a normal life, just to have a normal 24 hours without stealing, lying, cheating, taking money, spending money, whatever. Just having one day and then another day. You put one foot in front of the other. Days turn into weeks.
Yes, and it really is the feelings of hope in that are like immediate.
Correct.
Just like when you used the first time, right? The first time you used, you got that immediate effect. Yeah. You chase that effect, and then you're on, and then now you give yourself a chance. You come down, you get healthy again, and it's like immediate.
Right. And don't be afraid. What I tell people all the time is, where do you start? Well, you know what? You can start with your own doctor. You can start with an emergency room. You can start by going to an AA or an NA meeting, talk to people that are recovering.
Exactly.
It's not mystery. It's not rocket science. You can just do it. We have these phones. These phones are amazing. All you got to do is hit Siri. You can ask any question in the world.
Yeah.
You can get help. There's plenty of help. And you can't be playing Russian roulette with this disease, because basically that's what it is.
Yeah, well, as we know, it's alcoholism and drug addiction is a threefold disease, right? It's physical, mental, and spiritual.
Certainly is.
And so we want to physically get off the stuff, right? And we're going to need help with that.
Absolutely.
Some people I hear, they talk about, detoxing themselves. If you're an alcoholic, don't detox yourself, because you could die. Right. And if you're a heroin addict, I don't suggest you detox yourself either.
Absolutely
but
not.
if that's what it takes, a couple of days and get over that little thing. We can't do it alone.
Right. I mean, there are other methods. There's Withdrawal. There's Suboxone.
That's later on a little bit, I think.
But I mean, just to get well. Just to get well.
No
you
question.
can do it. Anyone can do it.
Yep.
I've done it. You've done it. Many people have done it.
No question.
It can be done. And it's not a mystery. It doesn't take anyone that's strong. You don't have to be physically strong, or emotionally, or mentally strong.
No, it's not a moral thing.
No, it's not a moral. People have it on a moral issue.
They do. They really do, and it's not. Right. It's not because you're a good guy or a bad girl or whatever. It's a real thing.
That's right.
And you brought up the harm reduction. Mm-hmm. And obviously with this new opioid crisis, or not new, but, opioid crisis the way it is, harm reduction is coming to the forefront with the Withdrawal and the Suboxones and the opioids, which are a bridge. Mm-hmm. Hopefully they're a bridge with a little counseling, a little therapy, right? And then eventually, the goal, obviously, hopefully, would be to be abstinent and then, move on with your life and not have to depend on any type of drug. We were talking about that earlier, just about arthritis or about chronic pain or any of that type of stuff. Right. No one really wants to be taking medication for the rest of their life, And
no matter how sick I've ever been, especially in early recovery, how bad I felt, how emotionally spent, everything. Broke, no job, depressed. I've never, ever left a meeting, an AA meeting or an NA meeting, mostly AA, feeling worse than when I walked in. I always feel better. There's always a spark of hope. There's something there. And I really believe that that's the like you said, threefold disease: physical, mental, spiritual. And when I say spiritual, I'm not talking about religion. I don't care. Your spirituality, it can be karma. It can be anything. Your higher power,
Buddha, whatever.
Doesn't matter. But I can tell you, the people in those halls, they've been there. They're there to help you. They need you. They want you. They love you. That's what they say.
Oh, yeah.
And they mean it, Some of my closest friends have been in the program and helped me out immensely over the years. Being sober one day at a time, that's the way to live.
Yeah, and it's funny. I could tell stories all day about people that have recovered and about being in. It doesn't matter whether you come from Yale or you come from jail. We were talking earlier. We have doctors that are heroin addicts.
Yep.
We have doctors that are addicts. We have lawyers. We have people who live on the street, homeless people.
Absolutely.
I mean, it's such a various. It's
an inclusive disease.
Yeah.
You know what? It can get anybody.
Yeah, and I was just looking at this. I was saying, it says that across America, the bonds of family, faith, work, community are fraying and fracturing because of this thing, right? Absolutely. And it affects everything in our life.
Sure.
And so we detach from happiness and driven by drugs, and you get caught in the cycles of hopelessness and addiction.
Sure.
But then we start to repair the broken bonds, right? And that's what recovery is all about.
That's what we're here. That's what we're about. Well, this has been a great show.
Oh, yeah.
I appreciate you coming in today. I know you're the step guy, but today you came in and you were the knowledgeable guy with all these facts.
Wow, facts and figures. I don't know, man. I don't even know who I am anymore.
Hey, that's it for today's show. We are Friends in Recovery, broadcasting live from the Studio 21 Podcast Café. Don't forget, you can reach us at help@friendsinrecoverypodcast.com or call us at the 800 number 1-800-989-6504. Find us on Facebook, Twitter, Instagram, and be sure you like us and subscribe. Come get sober with us, and we'll see you next week. Thank you.
The views and opinions expressed by the hosts, guests, or callers of this program do not necessarily reflect the opinions of the Studio 21 Podcast Café, the United Podcast Network, its partners, or affiliates.